But then in about 1930, Royal Rife, being an ophthalmologist working with lenses and that, developed what he called the universal microscope, with which he could magnify 60,000 times. Now, modern microscopes don't even reach that. Electron microscopes do, but remember that you have to kill your subject. But Rife needed no dye fixative, and he could observe his slide with bugs and things that were alive. In other words, going around, having a party, changing form and whatever. And he saw with his that the bacteria could change from tiny virus-sized particles into larger life forms. So Rife has now developed or described pleomorphism, which we don't recognize. Pleomorphism. So now he would take a skepi from that culture with that at that size, inoculate an animal and develop a sickness in that animal. And then he could filter those sizes through porcelain filters and inoculate the next animals. And each time he would produce the same sickness using a bug that big or its little precursor form that big. He would produce the same sickness. Koch used to say he had postulates for diversity, and each was applied successfully. Right? So now Rife is now looking in through his microscope, pushing light through these crystals and looking at a bug, doesn't know what the person's sick of, they've taken a swab, and now he's looking and adjusting the electromagnetic waves going through with the prisms, and then at a certain intensity, this bacteria would then start glowing. So now he knows he's dealing with tuberculosis, and after a while, this tuberculosis germ would start glowing, in other words, emitting photons. Syphilis, for instance, would always grow pink. Diphtheria would glow green or whatever. And according to the glow that he would see on that, he could diagnose what bug he was using. All right? When a bacteria is subjected to a specific light or a vibration intensity, it starts to glow. It starts to go into resonate and glow and give off photons. And the color was diagnostic. So remember physics first year physics. Do anybody remember? In my first year, they used to tell me that the wheel was square. So long ago it was. But physics then stated everything has got a specific vibrational frequency. This is glowing gray because it's giving out gray photons. And physics then said these waves or frequencies can go into sympathetic resonance. In other words, if I give this object that I'm exposing sympathetic waves to, give that object the same wavelength, it will then eventually start going into higher troughs, higher peaks. In other words, it'll be going, instead of nicely, it'll start shaking like a bridge. If soldiers march over it, it gets into sympathetic resonance, and the distortion will eventually mechanically break it. Next one. And Rife and his co-workers, the few he had, observed that after 3 minutes, this glowing bacteria would swell, would bloat, and it would burst open. So Rife could, by its color, diagnose what bug he was working with, keep that color going long enough, longer than 3 minutes, and he could then kill that cell. And then, once he's resonated that cell culture, he can put it into animals or whatever, and no sickness develops. Why? Because it's sterile. Next one. So, just to state it again, when identical waves coincide, they start resonating, okay? And the normal peaks and troughs are amplified, and this gives an increased mechanical distortion of the pathogen cell membrane. It's too much for this poor little bug. It ruptures and it breaks out. Can I now go to, I'm going to get back to that slideshow. I want to go back to the Rife cell. Okay, this is just a little video clip of this bug living happily in the tap water, and they're looking at it in the electron microscope. And it's full of cilia, and it's swimming, lecker. And after 3 months of getting its frequency that they know, it suddenly says, whoa, blucksome. Something's happening here. It draws water in, and it bursts. There it's happy as a pig in mud. And after about 3 minutes, you'll see those cilia starting to swelling up, and it blows. You see all that debris that comes off. That's the debris that, when you've been on the Rife, makes you tired and feel grim. That's why when you're rifing, you must drink water. Plenty of water so that you flush it out. And while I'm getting to the subject of water, purified water. This water that we drink in Pretoria and everywhere is besoedeld. It's full of chlorine and it's full of fluoride. It's grim stuff. So, now Rife took this, and he applied these principles, for instance, to reproducible tumors, okay? And he could reproduce a tumor. He would then look at them in his microscope, get their glow, and then resonate them and kill the tumor cells. Take a swab, inoculate, nothing would happen as long as it was killed. And Rife could see in the cell small virus-like particles, which he said was a human cancer virus, Cryptocidis primordialis. And in our Rife frequencies, you've got that frequency X, isn't it, that they call it? Yeah. That is specifically for the tumor virus that Rife looked at. So he then took 400 animals, gave the virus, and produced 400 tumors, and then rifed them. And in every case, every tumor was eliminated. Now that's pretty good science, eh? Then the University of Southern California, for instance, applied this therapy on 17 terminal cancer patients. All of them recovered without side effects after 4 months. Now this is what I hate about the Rife, and this is what I hate about ozone therapy, and this is what I hate about this kind of thing. These people develop their cancers and they come to you, or they go to the Rife clinicians. Man, terminal. Doctor, what can you do for me? Hell, if you had it early enough, you'd be much more successful. Okay? So very often we get patients, hell, doc, this guy's done this. Can we do anything for him? Yeah, well, look, he's got nothing to lose. He's only gonna die. So let's try the Rife, and let's try ozone. We get good results, but hell, if you could catch them early enough, you'd get better results. Okay. let's go for it. So Rife's work nearly died out because the apparatus was bulky and expensive. The medical world was skeptical, saying, Rife, that bloody idiot, you know? And doctors and dentists are traditionally slow in changing their paradigms. We've got closed minds. And this is all I plead for people is open your mind. Okay? Fleming, for instance, at that stage discovered penicillin, and the drug companies saw this as something that is patentable and whatever, and it worked. Penicillin and all that came onto the thing. So there was quicker money. And then, of course, the rapid advances in surgery during the world wars. Every world war produces a terrific amount of surgical progress. Okay, but modern technology, al-Geriala, have revived frequency therapies because microcircuitry is available, microchips have been produced cheaper, light resonators and so on. And I want somebody to start making us Rife apparatus or frequency generators that are specific. In other words, it's something small, and you go and buy a card that gives the frequencies at clicks, say, now I've got the new flu, I've got swine flu or whatever. Put it in, carry it in your pocket and resonate with it. Right, nowadays we're using Rife and frequency therapy in a lot of things. The Israelis didn't have antibiotics, okay, during the Yom Kippur War. So what did they do? They used the Rife frequencies, and they helped get past around the antibiotic shortages. 7/11 or 10/11 or whenever they blew those things, 9/11. What happened? These guys are attacking America, and how are they going to attack us now? They're going to use anthrax, and especially a very light anthrax, form of anthrax, in a powder form, so that when you open your letter, oh, here's a letter from Sonny, the dust is in you, and anthrax is highly infective. So they put all the letters and that on a conveyor belt, and they bombarded it with sympathetic resonance, broke that anthrax up if there ever was any. Okay? And nowadays doctors are opening their minds. Thank God they're opening their minds. And they're using Rife therapy in their practices. I use it in my practice a lot. Now, the trouble with science is that people want evidence, and it's damn difficult to show evidence except to say, Doc, I'm feeling a lot better. Then you say, oh, yeah, Mrs. Smith said she's feeling a lot better since using the Rife. And the other guy will say, that's just anecdotal evidence. Boy, they can break everything down by using anecdotal evidence. And anecdotal evidence is the father of science later. This is a man, it's the 13th of March, a friend of a friend of a friend. Terrible headaches for 3 years. They diagnosed a tumor on his thalamus, astrocytoma. The neurosurgeon says, go and get your will and everything in order, kry jou saak reg met die Here. You've got 3 months. Okay? Working in theatre, and the anaesthetist says, listen, my cousin has got this. Do you reckon you can help him with that stupid little black box of yours? I said, he's got nothing to lose. He's going to die in 3 months anyway. Well, what's it going to cost? I said, nothing to lose. It costs the cost of a bloody light bulb. Let's do him. So we started him on the astrocytoma programs. Now, this is the one thing that I want to tell you that I found about the Rife, is if you use the correct frequencies, they say, you will get results. If you're not getting the 100% correct, you've either got the wrong diagnosis and you're using the wrong frequencies. Okay, so we put him on astrocytoma 3 times a week. 16th of July, we redid his magnetic resonance scans. Now that's cutting him in layers down. We redid it. There it's undergone cystic degeneration. That's further down. You can see it's going. He has now got an operable tumor. Now here is just a slide so that guys, stupid guys like me can compare it. March, July. 2 weeks after us starting his astrocytoma programs, he said to me, "Doc, for the first time in 3 years, I haven't got headaches. I've lost contact with this man, but I know from his cousin that he's run 2 comrades marathons. I don't dare run a comrades marathon because of this tumor." Okay? Now, uses in practice, abscesses. To win time, I said, put you onto the Rife apparatus. I'll see you later. Put them on. And I put them on a strong one, osteomyelitis, because it comes from the mouth. They know all the bugs, so the frequencies are there. Put them on that, and he sits there holding this thing. And I'd go on with my other patients. Hour or so later, "Come, let's see you. Doc, I'm already feeling better. I don't feel so swollen anymore." Take him. Yeah, you've got an abscess. We can drain it. But already, within an hour or 2, they feel a bit of a difference. And I have won a little bit of time so I can sit and think, what the hell's wrong with him? Okay? Pain. Oh, Donner, pain is a good one. Comes in with acute pain, put him on. Nausea. Good one. Professor Robenheimer, his son, they were in cadet parade standing straight, and he had a bit of a flu and whatever, and he fell over forwards. Gah! Hit his jaw in the front, split his lip open, and broke his 2 condyles at the back and split his jaw. Came in and I said, "Let's take an x-ray." Put him in the Panorex machine. No, I can't even stand. I'm so gnar, I could vomit right here. I said, "Don't worry, nausea programs." Put him on. Half an hour later, take your x-ray. He's not gnar anymore. We took him to theatre and we gave him narcose. And he woke up with his jaws wired up, and he wasn't gnar at all. Put him on bone healing for a couple of weeks, and his jaw healed very nicely. Wound healing works beautifully. Hemorrhage, ring you up. Now you're out of theatre, and they say, "Doctor, Mrs. Smith is still bleeding. You know that patient that you took wisdom teeth out? She's still bleeding." I said, "Send the Rife down. Put it on hemorrhage." I'm telling you, 7 minutes later, no more bleeding. And the only thing that changed was that we put her on the Rife. It works beautifully for swelling, Coxsackie and cytomegalo, detox and dental foci. Now that's the one that I like. The Rife has got metal detox programs that my brother-in-law uses, and I don't like it. I don't like their metal detox programs. I'll tell you why. Because it goes in there with the frequencies and shakes the mercury and all that's bound to the thing. And it doesn't, it might possibly, my fear is it might possibly just mobilize it, and that mercury gets deposited elsewhere. If I detox somebody, I'd like to go in, bind it with a chelation metal, it gets it out. My fear with the Rife metal things is that it just mobilizes it and goes and sits elsewhere. But dental foci. Doctor, I can't afford to lose this tooth. We have to do a root canal. Now, I tell you something. This is a a recent attitude change of mine. I would rather have a black mamba in my pants than have a root canal tooth in my mouth. But if she has to have it, why don't you come in and we put you with dental foci? Because that goes and resonates and possibly kills the bugs that are still in the dentinal tubuli. That's my only way, I think, of sterilizing a dead tooth is to dental foci and then, of course, ozone. Ozonate it. You kill it with that, with the ozone as well. Next one, please. The nicest book, but it's now out of print, is The Cancer Cure That Worked. Now, I was very, very skeptical of Rife. My sister, Inky, she told me about it, and I said, "Ach, kakman, doesn't work, can't work. How does it work? Vibrations." And I read that book about of Barry Lyons, and I was there one long weekend, and this laborer, this maid came in, and she had things under her arm. She was grey with pain. And Inky said, "What do you think that is?" I said, "What are we going to do? Give her antibiotics?" I said, No. I know that this is caused by staphylococcus. Let's put her on the staphylococcus programs. I mean, she's, after all, we can use her as a guinea pig. Boy, oh boy, oh boy. She came the next day, we gave her the Rife, came the next day, it was smaller. By the end of that long weekend, this had gone. It didn't drain, no pus came out, it just shrank to nothing. Now, a lot of the guys that go at my brother-in-law's farm, they come in and they say, "Ooh, boss, as ek piepie, hy voel soos doringdraad." And then you know he's got gonorrhea. He puts them there and they sit opposite each other on the Rife, because you can, just by sitting in series, you can resonate your gonorrhea patients. It works, people.